Hi, today we're going to be talking about end-of-life care. End-of-life care describes the support and care given during or around the time of the person's death. That can be sudden or it can be expected, and some people will gradually fail, and others may involve end-of-life care could be months, days, or weeks. You must understand the dying process. Then you can approach the dying person with care and respect and kindness. Terminal illness is an illness or injury which the person will most likely not recover. Many illnesses and diseases have no cure, and the body cannot function after some of the injuries that they might have incurred. Recovery is not expected when they're terminal, and the disease or the injury ends in death. Doctors are also not able to predict the time of death. People ask all the time, how long do you think this is going to take? The doctors have no idea. They can kind of give you a timeline, but that's not for sure. Hope and the will to live strongly will influence living and dying for the person. Persons with terminal illnesses can choose palliative care or hospice care, and I know you've probably heard of hospice. Palliative care focuses on the relief of symptoms, and the illness is also treated. Care is for long-term illness that will cause death, and settings will include hospitals, nursing homes, and sometimes the person's home. Hospice care focuses on the physical, the emotional, the social, and the spiritual needs of the dying person and their families. Hospice care is not concerned with cure or any life-saving measures to help prolong that person's life. Often the person could possibly have less than 6 months to live. Hospitals, nursing homes, and home care agencies offer hospice care, and it may be a separate agency as well. Some attitudes about death. There's a lot of experiences, cultural, religion, age, and influence attitudes about death. Attitudes about death often change as a person grows older and with all the changing circumstances that come about. Practices and attitudes about death will differ among different cultures. In some cultures, dying people are cared for at home by the family, and some families prepare their own bodies for burial. If you look in your textbook on page 852, Caring About the Culture, it talks about some different nationalities and cultures that do things differently. It talks about Vietnam, Chinese, and then the India cultures. Also on page 853, it talks about the age, focus on the age and the older person, and it talks about children's views about death. So read those two sections in your textbook. Some spiritual needs related to the human spirit and to religion and religious beliefs. Attitudes about death are closely related to the religion. Some people believe in the afterlife and some others do not. There are also religious beliefs beliefs about the body's form after death. Some believe the body keeps its physical form, and others believe in only the spirit or the soul is present in the afterlife. Reincarnation is the belief about the spirit or the soul that is reborn into another human body or into another form of life. Some age factors. Some adults fear pain and suffering. Some people fear dying alone. That's a big fear in a lot of the elderly people. Some will fear the invasion of privacy, people getting into all their own personal things. Loneliness and separation from their loved ones is another fear that many adults have, leaving their children. How will they cope? Many adults are also worried about the care and support of those left behind. Who will care for my husband? Who will care for my children? Adults often resent death because it affects plans, hopes, dreams, and ambitions. Lots of things that they still want to do in their lifetime. The stages of death. Dr. Elizabeth Kubler-Ross described there's 5 stages of death and dying. The first stage is denial, where people say, no, it's not me. It can't happen to me. That's that denial stage. Then there's the anger stage. The person thinks, why me? How come me? Why was I picked? Then there's the bargaining. The person says, yes, me, but how about if I do this? They kind of continue to bargain their way through it. Then there's depression. the depression that comes along with it. The person thinks, yes, me. And then they think how sad it is, and they can't get out of the phase of what do they do now. And then there's stage 5. The person is calm and at peace, and they've accepted what's going to happen. And dying people do not always pass through all 5 stages. Some move back and forth in between the stages. Some might start off and get down to bargaining and then be in denial again. They can move back and forth. And some never make it all the way through all 5 stages. Okay. The next thing we'll talk about is comfort needs. Comfort involves physical, mental, and emotional and spiritual needs. Comfort goals are to prevent or relieve suffering to whatever extent possible. Respect and follow the end of the life wishes of the person. You need to listen and use touch. Some people may want to see a spiritual leader, and that is something that we do in the hospital, the nursing home setting. If someone asks to see a priest, a pastor, somebody from their church, whoever it is, that we do provide that. And you want them to take part in whatever religious practices they need to, and you're also going to provide privacy during prayer or spiritual moments. You're always going to be courteous to their spiritual leader and polite. And you're going to handle their religious objects with care or respect. Some people might have a Bible. Some people might have a certain book that they use. Some might have a rosary. There's many different things. And we're always going to handle those objects with care and respect. Okay, then we talk about the physical needs. Dying may take a few minutes, hours, days, or weeks. To the extent possible, independence is allowed. We have them do as much as they need for themselves. And as the person weakens, their basic needs are met for them. We're making sure we're doing bed baths, we're doing mouth care. And every effort is made to promote physical and psychological comfort during that time. The person is allowed to die in peace and with dignity. The person may have pain. Some dying people do not have pain, and some do have severe pain. And so pain management is going to be very, very important during that time. We always want to make sure that we're promoting good skin care, personal and oral hygiene, that we're helping them to keep their mouths moist. We're giving back massages, things that help to relax the person, and we're keeping them in good body alignment. Frequent position changes and supportive devices. We're making sure that we're still supporting them to keep them from getting to cubes, bed sores, things like that. Some people may have breathing problems during this time. Shortness of breath and difficulty breathing. As we know, dyspnea is also difficulty breathing. And they're common at the end of life problems. So you always want to make sure that you have the person in the semi-Fowler's position, and oxygen is very helpful during that time. There's something called the death rattle, which is some noisy breathing that really occurs as death nears. This is due to mucus collecting in the airways, and it may help to put the person in the sideline position, and then the nurse suctions them or gives them medication to relieve the mucus and reduce the amount of mucus that's in their trachea. Vision and hearing and speech. Vision blurs and gradually fails. Secretions may collect in the corners of their eye that needs to be cleaned out, so you're going to be doing good eye care for them. Hearing, like I've said before, is one of the last functions to go, and always assume that the person can hear you. Speech becomes harder. It may be hard to understand the person, and sometimes the person cannot speak. So you're going to have to sometimes either give them a little board to write on or try to understand what it is they need. Mouth, nose, and skin. The oral hygiene promotes comfort. Oral hygiene is needed if mucus collects in the mouth of the person and they cannot swallow. We're going to be doing good skin care. Crusting and irritation in the nostrils can occur. Nasal secretions, oxygen cannulas, and other nasogastric tubes are common causes. So we're going to keep those areas clean. As their body begins to fail, circulation fails, and the body temperature rises as death nears. The skin is pale and cool and mottled or blotchy. At the lower part of the extremities, you will see some purple blotchy marks developing. Perspiration increases. They could begin sweating. Skin care, bathing, and preventing pressure ulcers is also necessary. Nutrition. They could have some nausea, vomiting, and loss of appetite will occur as the end nears. As death nears, the loss of appetite is common. The person may choose not to eat or drink. Elimination. Their urinary elimination or fecal incontinence may occur, and constipation and urinary retention are very common. So sometimes they give enemas during that time to help relieve constipation because it could cause that person to have a lot of pain. The person's room is to be kept comfortable and pleasant, and you're going to remove any unnecessary equipment from their room. The person and the family will arrange the room as they wish, and that you will help them to meet their love and belonging and their self-esteem needs. And the room should reflect the person's choices. Their mental and emotional needs are very personal. Some people are going to be very anxious, and some people will be very depressed. And others have specific fears and concerns. And some examples would be severe pain, and when and how will death occur. These are a lot of things that people worry about. What will happen to loved ones after I pass, and then dying alone. People are very fearful of being by themselves. This is always a hard time for the family, and you're going to show your care by being available, courteous, and considerate. Family members usually stay as long as they wish and respect in their right to privacies, but you're not going to neglect the care of the person because the family is present. You're still going to go in there and make sure that they're comfortable during this time. The family also goes through a bunch of stages of death, just like the dying person, and they need support, understanding, and courtesy, and they might also need a spiritual leader for comfort. There also is going to be a lot of legal issues that can occur, and consent is needed for any treatment. And when able, the person makes care decisions, and some people make their end-of-the-life wishes known. The Patient Self-Determination Act in OBRA gives the persons the right to accept and refuse any treatments and then make their advance directives. And we know that from before, the advance directive is a document stating the person's wishes about their health care decisions that they cannot make on their own. And that gives somebody in their family that direction to do that. A living will is a document that measures the support and maintain their life when death is likely. A living will may instruct the doctors not to start any measures that prolong dying or to remove any measures that are going to prolong dying. The durable power of attorney gives the power to make healthcare decisions to another person. And after consulting with the person and the family, the doctor has to write the order for DNR, do not resuscitate, or no code order for a terminally ill person. And this means the person cannot be resuscitated. Some signs of death. In the weeks, days, or hours before death, the following may occur. They become very restless, agitated. They can be short of breath, very depressed, have anxiety, more drowsy than usual, start having confusion, problems with constipation or incontinence. They become very nauseated. They have a loss of appetite. They have healing problems, swelling in their hands, feet, and other body areas, and then some pauses in their breathing. As death nears, the following signs may occur, fast or slowly. Movement, muscle tone, and sensation are lost. Peristalsis or other gastrointestinal functions will slow down. Their body temperature rises. Circulation starts to fail, and the respiratory system fails as well. Pain decreases as the person loses consciousness. The signs of death include no pulse, no respiration, no blood pressure. The pupils are fixed and dilated, and the doctor determines that death has occurred.